Health Education and Improvement Wales is a really important part of the NHS, and our job is to work with our partners in order to develop a skilled and sustainable workforce for health and care in Wales, to make sure that we're improving patient care and supporting population health. 2023-24 was a really challenging context for the whole of NHS Wales, but I'm really pleased to say that we've been able to make so much progress on many of the things you're going to hear about today in this video.
This year, the Dental Deanery has made great progress. Our latest Train Work Live campaign was viewed 2.4 million times, and we've successfully filled all dental foundation training posts, including all Welsh Enhanced Recruitment Offer posts for the second consecutive year. This initiative strengthens training in rural practices while expanding access to dental care in underserved areas. Through our All Wales training forums and end-of-year surveys, we've gathered crucial feedback to continuously improve education, quality and outcomes for both dental trainees and patients.
In HRW, we support over 3,500 medical trainees in over 50 different medical specialties. We quality manage our posts through our quality management processes, and we engage extensively with our trainees and our trainers so we can continuously improve. So this year we've developed a really exciting initiative. All of our new International Medical Graduate Foundation trainees now have an extended period of shadowing before they start foundation training properly. This enables them to really understand the systems, the procedures, the processes of working in the NHS in Wales, which will ultimately enhance their training experience, but also improve patient care.
The Endoscopy Academy opened in January. By being able to train the multidisciplinary team, and that means doctors, nurses, clinical endoscopists, admin people to an endoscopy, we're trying to promote the whole workforce and make sure that we can provide higher quality, safer services for our patients, and also tackle the waiting list by making sure that our staff are competent and confident for practice.
In June, we launched the Digital Capability Framework for Healthcare in Wales. The framework provides a practical, interactive tool for all healthcare staff to better understand the skills, behaviours and attitudes required to thrive in a digital world. For the first time ever, we now have data that evidences the digital capabilities of the workforce in Wales. Technologies are transforming the way healthcare is delivered, and it has never been more important to empower staff to feel confident and capable in using technology.
We led on the NHS Wales Staff Survey 2023. We developed the evidence-based survey to collect valuable feedback from colleagues across NHS Wales at a national level to gain an understanding of the insights and experiences in relation to their work environment, job satisfaction and well-being. Over 22,500 colleagues responded to the fully anonymous, bilingual and accessible survey. The data will now be used to carry out improvements to work environments so that staff can thrive and deliver continually improving high quality, compassionate care to the communities that we serve in Wales.
This year we launched our inaugural Aspiring Chief Executive Programme and Aspiring Executive Director Talent Pool. I'm delighted to share that these inaugural programmes have already supported the career transition of 18 aspirant executive and board level directors.
From September 2023, we offered online modules in areas such as making every contact count and quality improvement, so that optometrists and support staff in practices in the high street could actually have those valuable making every contact count conversations with patients for the first time. So we've also commissioned higher qualifications so that optometrists can actually manage more patients in high street optometry practices in areas such as glaucoma and independent prescribing.
This year, for the first time ever, we have run 2 cohorts of the Advanced Clinical Leadership Programme. One cohort of 28 delegates has been based in South Wales and a cohort of 26 delegates based in North Wales. The programme supports senior clinical leaders to develop their leadership skills. So the benefit of holding the programme locally for our colleagues in the North includes reduced travel time. This also results in a reduction in the time the clinical staff are away from their clinical duties and indeed their families.
So in a climate of reducing applications to nursing programmes across the whole of the UK,
we've done a programme of work to maximise the recruitment and student nurses in Wales. We've supported the Healthcare Connect and Fast Track programmes of FE colleges. We've maximised the number of healthcare support workers training to be nurses. We've supported the Aspiring Nurse programme in Paris Teaching Health Board. We've supported learning disability champions to promote the profession.
It's been over a year since the launch of the Strategic Mental Health Workforce Plan. Working in partnership with Social Care Wales and the voluntary sector, we've already increased university places for mental health roles, improved access to workforce data, launched a new mental health digital learning space on Ystadysgu, raised the profile of the lived experience workforce and started working towards a national recovery college model. We've had positive feedback from the workforce and those accessing services. We look forward to continuing efforts to increase, support and develop our mental health workforce.
The staff retention is a vital part of sustaining and maintaining our workforce for the future. So during 2023 and 2024, we have launched the National Retention Programme and also the Associated Nurse Retention Plan.
General Practice Nursing Foundation Programme was developed for new nurses coming into general practice nursing. The benefit of the programme allows the nurses that are new to general practice or newly qualified the time with a dedicated practice supervisor to consolidate all of their learning, education and training, which is quite hard to come by in general practice. Cohort 2 is nearing the end of completion and it's been a massive success for us. The numbers and the demand for Cohort 3 are increasing in the previous 2 cohorts.
We've been working with organisations across NHS Wales on the Improving Employee Investigations programme. We recognised a number of years ago that actually the disciplinary process and the investigations that follow can cause those involved in them considerable harm. And we also recognise that it impacts the organisation from a cultural perspective and from an economic one too. So it's been great working with HR teams and colleagues to find a more compassionate way to run these processes that focuses on the health and well-being of the individuals involved, as well as maintaining the need to run an efficient and effective disciplinary process.
The Strategic Pharmacy Workforce Plan was identified as a priority in 2022 by HCIW. This was in response to evidence of pharmacy team burnout, reduced access to patients' pharmacy services, and increased workload pressures. The benefits of the plan will be to create the right environment for pharmacy teams to provide the best pharmaceutical care to patients across Wales.
So I'd really like to thank all of our staff for making this possible. I'd also like to call out our partners, particularly our NHS colleagues, for helping us along the way, because this is really a collective effort. But at the end of the day, we can't be complacent. We know there is a lot more work to do, and in HIW, we're absolutely committed to helping people improve what we're doing with our workforce to make sure that we have that skilled and sustainable workforce for NHS Wales.